Your Worship, the Lord Mayor of Kampala, His Worship Elias Kavukwago, you are very welcome. Distinguished guests from the U.S. government, Lisa Nelson, CDC Country Director, Richard Nelson, Youth State Mission Director, Donna Kabatesi, Associate Director, Programs, and Heather Smith-Taylor, USAID Health and HIV Officer Director. You're very welcome to KCCA. And our implementing partners, Executive Director, IDI, Dr. Andrew Kambogu, and Chief of Party, USAID Maternal and Child Health Activities, Dr. Nathan Tumwesije. You are all very welcome today. Let me also welcome the Chief of Party, USAID Social and Behavior Change Activity, John Hopkins Center for Communications Program, Glory Kandowide. Your Excellency, the National Development Plan 3 highlights that improving the quality of life of all Ugandans is a central goal, and therefore improvement of public health and environment management is critical. KCCA is tasked with ensuring that Kampala has healthy and productive citizens and fostering of healthy equity, equality, creation of frameworks for urban health and partnerships, which are critical to the attainment of the improved quality of life for the Kampala populace. Kampala City has a very large urban poor population. 57% of the 4.5 million people accessing the city during the day are urban poor. That is more than 50% of the people on our streets and who we daily interact with are urban poor. With an annual demographic growth rate of 3.9%, according to the KCCA statistical abstract for the year 2019. Migration of the population makes disease surveillance and community-based service delivery very, very complex. People move from the rural places to come to the city, and planning for them continually is a very complex exercise. The health service delivery in Kampala City, as documented in the draft Kampala Urban Strategy of 2021 to 2025, shows a dominant private sector in health that constitutes 99% of the approximately 1.5 million health facilities within the city. Poor urban-specific referral pathways, in addition to dominance of self-referral tendencies, execution of the non-urban driven health policies and guidelines as the blueprint in these key documents does not apply to an urban setting. We have very heavy congestion in the 25 public health care facilities, which we run absolutely free because they are dominated by the urban poor in our settlement, 6.9% among adults aged between 15 to 64 years, according to the 2016 Uganda Population HIV Impact Assessment. Apart from HIV, we have the challenge of TB. The estimated TB prevalence is 501 TB cases per 100,000 persons, which is higher than most urban settings in Uganda, according to the 2014 Uganda TB Prevalence Survey. Therefore, having CDC today support KCCA under government-to-government agreement is extremely welcome and will enable us to do various things, including build the capacity for coordination, build partnerships, build governance, human resource capacity for HIV and TB service delivery, integration of HIV and TB services with other disease programs, integration of health information systems, integration for surveillance, including M&E and laboratory systems strengthening. This has been made very significantly needed because of the current pandemic that we are facing. KCCA greatly values and welcomes the partnership with U.S. Centers for Disease Control and Prevention, who are providing a 5-year award of 1.631 million grants USD annually to KCCA to support urban HIV/TB services. Award, and we are very grateful. This project is building on earlier efforts by CDC through Infectious Disease Institute to strengthen the urban health services in Kampala. That KCCA has embarked on a campaign we have dubbed the Smart City Campaign. This campaign has 2 arms. It embraces the outer infrastructure we use, that is the roads, the health facilities, the drainages, the schools, the city lighting, the visible things that make our city smart. But it also focuses, and more significantly, on the inner infrastructure of the life of our citizens. The way we think, our mindsets, the way we act, the way we work, the way we talk. We are saying, let's do it smart. Let's do everything we do, let's do it the smart way. Not just the looks, the visible infrastructure, but the lives of the people. We've therefore started a campaign to partner with significant media forums like the New Vision Group, the Monitor, and others, so that we do community education about the things that we are rolling out in the communities, how they can be utilized, so that our infrastructure is not vandalized and the health facilities are well utilized. And we are embarking on an aggressive campaign of community education to ensure that the mindset, the thinking, the acting, the talking is empowered for our citizens. Significant award to KCCA of $1,631 million USD will facilitate us further in this campaign to ensure that the lives of Kampala residents are improved as we endeavor to build a smart city. I thank you, Your Excellency. I thank you, the U.S. government, for the government support, and I welcome you to KCCA. Thank you.